It's my pleasure to welcome you to this meeting today. I'm sorry that I'm not able to be with you in person, but I am pleased to be able to talk to you today. And I hope that today's event will be the first of many. As public health trainees, you're a richly diverse group, and this is a great strength. However, it also means that you don't have a natural collective identity. It's less easy to define a public health trainee than it is to define a trainee in orthopedic surgery, for instance. You come from a range of backgrounds. You work in many different settings. All of these factors can weaken the sense of professional identity. Days like today are important because they help to strengthen this identity, which I think is absolutely vital. I believe that there's a very strong ethos in public health. As public health professionals, we're bound together by a solid set of principles and by a commitment to improve the population's health. It's important, though, that we also share a sense of identity, a common language, and a common set of concepts. Public health practitioners should never work in isolation. It's vital that we are thoroughly networked with one another. You need to be using every communication tool available to learn about best evidence-based practice elsewhere. You need to be drawing on personal networks to learn what colleagues are doing. I hope that today will offer an opportunity to develop these networks and to share this information. I hope you will also discuss how this sharing process can be better developed so that public health practitioners can work more cohesively together. There'll always be a need for public health practitioners as a professional group. The challenges will change, but there'll always be challenges. For me, part of the fascination of public health is its evolution. As one problem diminishes, another emerges. Multiple, subtle changes in society have reduced the amount of activity involved in everyday life. As a result, the obesity epidemic looms large. Climate change is another important public health threat. We wouldn't have been able to see that when I started my career. With every new challenge comes a new opportunity to use and to develop public health skills. I would set you the challenge of being crystal clear about the value of public health and being able to communicate it well. Nobody can know exactly what the future holds, but we can make some educated guesses. And I certainly see a more diverse public health landscape than when I was training, with the third sector being involved to a much greater extent than in the past. As trainees, you'll need to decide where you can make best use of your individual talents. Some of you will thrive in government, some in NHS services. Some of you will carve out entirely different careers. Some will establish fundamentally different public health services. I hope that your training gives you the skills that you'll need whichever route you pursue. I hope that today gives you an opportunity to understand your options more fully and to be inspired by the work that others are doing. Public health is the classic broad church. There are many and diverse opportunities, working in the NHS, in an academic role, diversifying into management or a healthcare organisation or an agency. Other opportunities could include working overseas in the developed or the developing world, or working for an international agency like the World Health Organization or World Bank. All these things are possible if you have a qualification, training, and experience in public health. I myself started in clinical practice in surgery, then trained in public health, held academic appointments in epidemiology, became a regional director of public health, before I then moved into a chief executive role, and now I'm working within government. I've also worked for and with the World Health Organization. It's been an immensely fulfilling and enjoyable career. At times I've felt like a Cinderella championing seemingly lost causes. At other times I've seen the power of mass change in attitudes across a whole country, a whole population, or a whole profession. When that happens, it's truly inspiring. I'd encourage you to be bold. The future is yours to make. It'll bring challenges and it'll bring opportunities in equal measure. Your task is to rise to the challenges as well as to seize the opportunities. As a cohort, You will define the future of public health. The bell is tolling for you as a new generation of public health leaders, and I feel sure that our specialty will flourish in your hands.